Hi, I'm Shannon Young, and today I'm going to talk to you about strategy development for substance use disorder treatment of New York's unhoused and perinatal population. So, first, let me introduce myself. My name is Shannon Young, and I sit on the state's Overdose Fatality Review Committee, as well as the Pregnancy and Postpartum Death Review Committee. And between those two groups, we do see some overlap, which highlights the need for some strategies to engage the perinatal unhoused population in substance use treatment. So let's go around and introduce ourselves, and if you guys could tell me your name, affiliation, and your area of expertise. And you may have already noticed that we have a diverse group in here, including obstetrics, gynecologists, obstetricians and gynecologists, and doulas, midwives, people serving the unhoused community, as well as those who are experts in substance use treatment. And once we do the introductions, the agenda for today is to go over our presentation, which will include some substance use treatment background, as well as some brainstorming sessions on barriers to treatment and local resources within the community. The objective is to explore existing barriers and resources within the community to develop strategies for increasing substance use disorder treatment and improve maternal outcomes for New York's unhoused and perinatal population. So let's go through the history of substance use disorder treatment. Starting back in the 1760s to early 1800s, the most common form of treatment was sobriety circles, which were originally made up of Native American Indians. In the 1800s, the focus remained on alcohol treatment, and we did see some other addiction treatment strategies. One was Freud recommended cocaine use for treatment of alcoholism and opioid use disorder. In 1864, New York opened the New York State Inebriate Asylum. It was the first medically monitored addiction treatment center within the U.S. And in the 1890s, inebriate homes and asylums were closed down. The standard treatment became to put people in drunk tanks or send them to insane asylums. In 1901, New York opened the Charles B. Brown Hospital, which is a substance abuse hospital or substance abuse treatment hospital, the cost of which was $350 per day, which in 2023 dollars, that would be $12,820 per day to receive treatment for substance abuse disorder. In the 1910s, legislation was passed to allow medical personnel to sterilize addicts, alcoholics, mentally ill people, and mentally disabled people. In 1919 to 1924, morphine maintenance clinics were opened, and most eventually were closed down for legal reasons. In 1935, narcotics farms opened up, which were federally funded facilities which provided treatment for addiction and also advanced addiction research. In 1964, methadone was introduced as a treatment for narcotics addiction. And in 1970, we saw the Controlled Substance Act pass. This classified drugs into 5 classes and introduced restrictions on prescriptions of narcotics. In 1971, Narcan injection was approved by the FDA as an immediate treatment of opioid overdose. And in 1987, we saw the American Medical Association designate all addictions as diseases. From here on, you'll see some changes that will make or show society viewing addiction as more of a disease than a shortcoming in people. In 1999, we saw the Drug Treatment Act passed, defined stricter requirements for physicians prescribing narcotics, and in 2002, the FDA approved buprenorphine for opioid use disorder. Okay, so let's see if we have any thoughts or reflections, if anyone has anything they'd like to share on this historical path, or any additions that may be important to the group. And we can go over a little terminology before we get too far into this. So substance use is taking illicit substances, but being able to stop use without medical intervention. Substance use disorder is taking illicit substances but you still need medical intervention to stop using the substances. So there are more detailed definitions that people within the substance abuse treatment community will use, but these are general definitions to just kind of help you, those who aren't familiar with substance abuse treatment, help you follow along. Also, the perinatal period is the time during pregnancy and the year following delivery or the termination of the pregnancy. So what we do find is that a lot of the people who do practice substance use, upon learning of pregnancy, many will decide to either decrease or terminate their substance use. And this is important because all the changes that are happening in a woman's or a person's body during pregnancy can change the way the body processes and reacts to substances, and this can create a prime situation for overdoses. So medically supervised substance use disorder treatment can be life-saving during this perinatal period. The American College of Obstetricians and Gynecologists recommends medication-assisted treatment, or MAT, for perinatal people with opioid use disorder. They specifically caution against supervised withdrawal without MAT due to higher risk of relapse and decreased maternal outcomes. Medication-assisted treatment, even though it is recommended, is often underutilized in perinatal populations despite being the standard of care. So let's look at some barriers to medication-assisted treatment for perinatal people. First, we see that providers are not educated about the safety of MAT. Providers are not comfortable with MAT. There's often stigma around perinatal people using the substances, which can inhibit them from getting the treatment that they need. And some populations have a historical distrust of medical providers, such as the African American community and Native American Indian community. So it's important to address these situations and provide solutions that address these situations as well. And let's review some other barriers that we see within the community. We can look at those barriers in terms of general barriers to substance abuse treatment, as well as barriers that we see for perinatal people trying to access substance abuse treatment, and unhoused people trying to access substance abuse treatment. And we can look at those same barriers locally and review again general barriers as well as barriers for perinatal people and barriers for the unhoused population. So let's recap. MAT is the recommended treatment for substance use disorder during the perinatal period. Our community has barriers to care, which we've discussed, and we also have some resources within the community that we have discussed. In the next session, we're going to revisit the barriers to care and existing resources within the community. And after reviewing those, we are going to identify some gaps in care, and we'll also strategize on possible solutions to increasing engagement in substance use treatment for this population of unhoused perinatal people in New York. And these are my references. And thank you very much.